Want to pass the NCLEX RN with confidence? You're in the right place. This video is packed with realistic NCLEX-style practice questions, SATA, case studies, calculations, highlight, and more. You'll get time to answer, then we'll walk through each option, why it's right, why it's wrong, so you don't just memorize, you understand. Grab your notes, eliminate distractions. Let's train like it's test day. Question. Imagine this scenario. A 28-year-old client arrives at the emergency department. They're complaining of vomiting, abdominal pain, and this has been going on for the past 24 hours. Now, they also mention feeling extremely thirsty and fatigued, which should raise some concerns. On assessment, the client appears confused, with dry mucous membranes, meaning they're likely dehydrated, and they're breathing in a distinct pattern known as CRUSH respirations, deep, rapid breaths that signal the body's attempt to correct a severe acid imbalance. Now here's the key part. Let's look at the lab results. Blood glucose, 500 milligrams per deciliter. That's very high. pH, 7.20. That's low, meaning the blood is becoming dangerously acidic. Bicarbonate, HCO3, 10 milliequivalents per liter. Also low, showing the body's buffer system is failing. Urinalysis, positive for ketones. That's a clear sign the body is breaking down fats for energy. Now, based on this information, what condition does this client have? Think carefully. The correct answer is diabetic ketoacidosis, or DKA. Now let's break down why. 1. Hyperglycemia. The client's blood glucose is 500 milligrams per deciliter. That's dangerously high. Remember, normal blood glucose usually ranges from 70 to 140 milligrams per deciliter, depending on meals. 2. Ketonuria. The urine test is positive for ketones, which means the body is using fats as an energy source instead of glucose. That's a big red flag for DKA. 3. Metabolic acidosis. The pH is 7.20, which is dangerously low, and bicarbonate HCO3 is only 10 milliequivalents per liter, far below the normal range of 22 to 26 milliequivalents per liter. These values confirm that the blood is turning acidic, a classic DKA feature. But what's happening inside the body? DKA occurs when the body doesn't have enough insulin. Without insulin, glucose can't enter the cells, and since cells aren't getting the energy they need, the body starts breaking down fat for fuel. Now here's the problem. When fat breaks down, it releases ketones. And ketones, they're acidic. As ketones build up in the blood, the pH drops, making the blood more acidic. Meanwhile, the body tries to fix this by breathing faster. Those deep, rapid, CRUSH respirations are the body's way of blowing off acid, carbon dioxide, to restore balance. Why do these symptoms happen? The nausea, vomiting, and abdominal pain? That's the body reacting to the toxic effects of high ketone levels. The extreme thirst? That's dehydration caused by excessive urination as the body tries to flush out extra glucose. The confusion? That's due to electrolyte imbalance and the brain struggling to function in this acidic state. And those distinct CRUSH respirations? That's the body's desperate attempt to correct the acid buildup by breathing out carbon dioxide. In short, diabetic ketoacidosis, DKA, is the condition. It's characterized by hyperglycemia, ketonuria, and metabolic acidosis. This is a medical emergency, and recognizing those warning signs, confusion, dehydration, CRUSH breathing, and high blood sugar, can be life-saving. Now here's a takeaway tip. If you see a patient with high blood glucose, low pH, and positive ketones, think DKA right away.
Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the NextGen RN Practice Question Bank, Big Book of Question Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new Next Generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions.
All right, everyone, let's talk about something that really matters in patient care: coping mechanisms and emotional support, especially when the diagnosis is life-changing. You've got a client who's just been told they have cancer. Now pause. Imagine what they're going through: fear, uncertainty, grief, questions. Here's your NCLEX question. A nurse is caring for a client newly diagnosed with cancer. What is the best way to support the client's coping mechanisms? Your options are: A, encourage the client to join a support group for cancer survivors. B, tell the client to focus on positive thoughts to avoid stress. Suggest the client avoid discussing the diagnosis to reduce anxiety. Advise the client to make major life decisions to regain control. Take a breath. Now think, what would you need in that moment if it were you or someone you love? Let's go through each choice. Option A, encourage the client to join a support group for cancer survivors. Yes, 100% yes. This is the best way to support someone emotionally in this situation. Support groups connect people with others who truly understand because they've been there. It offers shared experience, emotional validation, coping tools, and hope. It's compassionate, it's empowering, it's therapeutic. This is psychosocial nursing care at its best. Option B, tell the client to focus on positive thoughts to avoid stress. Okay, it sounds nice, but telling someone to just stay positive can actually invalidate their real painful emotions. They need space to feel, to process, to cry if they need to. And that's okay. Healing begins with acknowledging feelings, not avoiding them. Option C, suggest the client avoid discussing the diagnosis to reduce anxiety. Oof, big no. Suppressing thoughts or avoiding the topic can actually make anxiety worse. Discussing the diagnosis, when they're ready, is how clients process and adapt. As nurses, we need to encourage healthy expression, not silence. Advise the client to make major life decisions to regain control. This might come from a well-meaning place, but making big decisions in the middle of an emotional storm? Risky. We want clients to cope first, feel supported, and gain clarity before making life-altering choices. That's what keeps their decisions grounded and safe. NCLEX Insight. When in doubt, support systems are your go-to. If the question mentions coping, think, what helps the client feel seen, heard, and not alone? So yes, in this question, the best answer is encourage the client to join a support group. Because healing isn't just physical, it's emotional too. A 75-year-old male has a history of heart failure and presents with shortness of breath. ECG shows peak T waves and a widened QRS complex. Which electrolyte imbalance should the nurse suspect? A, hypokalemia, B, hyperkalemia, C, hypercalcemia, D, hyponatremia. Correct answer B, hyperkalemia. Explanation. Let's pause here. Peak T waves are a red flag. Combine that with a widened QRS, and we're likely looking at high potassium levels. Hyperkalemia. B is correct. Hyperkalemia can be life-threatening because it affects the heart's conduction system. Hypokalemia causes flat or inverted T waves, not peaked ones. C. Hypercalcemia might show shortened QT intervals, but not these classic tall T waves. D. Hyponatremia doesn't usually show dramatic ECG changes. It presents more with neurological symptoms. When you see sharp, tall T waves, think, too much potassium, and act quickly.
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything, clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and most importantly, help you feel more ready. Good luck. You've got this.
All right, class, let's dive into another important case. This time, it's about managing a patient with a COPD exacerbation. Pay close attention to the signs and what they might mean for your first nursing action. Passage. A nurse is monitoring a patient with chronic obstructive pulmonary disease, COPD exacerbation. Here's what we know. The patient's oxygen saturation is 88% on 2L nasal cannula. Respiratory rate is 28 breaths per minute. The patient is using accessory muscles to breathe band. Now in response, the nurse begins to consider several options, increasing oxygen to 4L, performing a respiratory assessment, notifying the provider, or encouraging pursed-lip breathing. Instruction. Highlight the nurse's first action to manage the patient's acute condition. Let's pause here for just a moment. Imagine you are the nurse at the bedside. You're watching this patient breathe fast, working hard to get air in, and their oxygen is low, but not dangerously low for someone with COPD. So what do you do first? Ready? Let's reveal the answer and walk through the clinical reasoning together. Answer: performing a respiratory assessment. Explanation: this is a physiological adaptation question, meaning we're being tested on how we manage an acute health problem using clinical judgment. So what's going on here? Your patient is showing clear signs of respiratory distress. O2 sat is 88%, which is borderline for someone with COPD. Breathing is rapid. They're using accessory muscles. That's effortful breathing. But before you jump into action, you assess, because assessment always comes first. A good respiratory assessment would include listening to lung sounds, observing chest expansion, checking for cyanosis, monitoring for changes in consciousness or mental status. This gives you the full picture so you can safely decide what comes next. Now let's briefly walk through the other options. Increasing oxygen to 4L. Sounds helpful at first glance, right? But here's the thing. COPD patients often have a target oxygen range of 88% to 92%. Going too high can suppress their respiratory drive, especially if they rely on hypoxic drive to breathe. so increasing oxygen might be dangerous without a full assessment. Notifying the provider. You'll get there if needed, but calling without complete assessment data? That's like handing over a half-finished puzzle. Providers need your full report first. Encouraging pursed lip breathing. It's a great technique to help control breathing, but again, not your first priority in this acute moment. You need to assess to know how serious this situation is. So here's the big takeaway. Your first job isn't to act. It's to look, listen, assess. That's how you protect your patient and ensure everything else you do is informed, safe, and effective. Highlighting option B, performing a respiratory assessment, reflects exactly the kind of sound clinical judgment the NGN Next Generation NCLEX is built to test. We have a 24-year-old female with type 1 diabetes mellitus who is presenting to the emergency department, ED. She's been feeling nauseous, vomiting, and experiencing abdominal pain for the past 12 hours. To make matters worse, she has missed her insulin doses for 2 days because she lost her prescription during a move. She also mentions she's been feeling extremely thirsty and has been urinating frequently. Her vital signs show signs of stress. Blood pressure, 90/60 millimeter is low, suggesting dehydration. Heart rate, 120 BPM, is high, which could be a compensatory response to dehydration. Her respiratory rate, 28 breaths min, is elevated and deep, which may indicate small breathing, a sign of metabolic acidosis. Oxygen saturation, 96%, is fine, but the respiratory rate and heart rate are concerning. She also has a temperature of 99.5 degrees, which is slightly elevated, could indicate an infection or stress. Her physical assessment shows dry mucous membranes, a clear sign of dehydration. Fruity breath odor. This is important because it's a classic sign of diabetic ketoacidosis, DKA, which occurs when there's a lack of insulin leading to fat breakdown and ketone formation. Abdominal tenderness, but no rebound pain, which might indicate an abdominal issue but isn't the primary concern here. The lab results show glucose level of 450 milligrams clearly high, which is expected in DKA. Urine is positive for ketones, also pointing towards DKA. The home medications include insulin glargine and insulin aspart, but she missed doses of both for 2 days. Question 1. Recognize cues. Which of the following findings is the most specific cue indicating diabetic ketoacidosis, DKA, in this client? A. Blood glucose of 450 milligrams per deciliters. B. Fruity breath odor. C. Respiratory rate of 28 breaths min. D. Nausea and vomiting. Let's think about the options. A. Blood glucose of 450 milligrams deciliters. While high blood sugar is definitely a sign of a problem, it's not specific to DKA. High blood glucose can also occur in other conditions like hyperosmolar hyperglycemic state, HHS. It's an important finding, but it doesn't single out DKA. B. Fruity breath odor. This is very specific to DKA. The fruity smell comes from acetone, a ketone produced during fat breakdown when insulin is insufficient. This odor is classic for DKA, so this is the most specific cue. C. Respiratory rate of 28 breaths min. The client's deep and rapid breathing is characteristic of Kussmaul respirations, which are a compensatory mechanism for metabolic acidosis, a hallmark of DKA. However, rapid breathing can happen in other types of acidosis too, so it's not as specific as fruity breath. D. Nausea and vomiting. These symptoms are common in many conditions, not just DKA. So while they are present in this case, they are nonspecific and don't point directly to DKA. Question 2. Analyze cues. Which of the following findings should the nurse associate with the development of DKA in this client? Select all that apply. A. Missed insulin doses for 2 days. B. Dry mucous membranes. C. Blood pressure of 90/60 millimeters. D. Temperature of 99.5 degrees. E. History of type 2 diabetes mellitus. Let's go through each option. Missed insulin doses for 2 days. This is a key factor in developing DKA. Without insulin, glucose can't enter cells, and the body starts breaking down fat for energy, creating ketones. This is a major contributor to the development of DKA. B. Dry mucous membranes. This is a sign of dehydration, which happens in DKA due to osmotic diuresis, when high blood sugar causes frequent urination. This is definitely associated with DKA. C. Blood pressure of 90-60 mm. This low blood pressure reflects dehydration and fluid loss in DKA. So yes, this is a clear finding associated with DKA. D. Temperature of 99.5 degrees, 37.5. While a slightly elevated temperature could indicate an infection, which could trigger DKA, this isn't a direct sign of DKA. It's more of a secondary finding and doesn't directly point to DKA. E. History of type 2 diabetes mellitus. The client actually has type 1 diabetes. DKA is more common in type 1 diabetes, so this history is incorrect in this case. Question 3. Prioritize hypotheses. Rank the following conditions from most likely, 1 to least likely, based on the client's presentation. Diabetic ketoacidosis, DKA, acute pancreatitis, hyperosmolar hyperglycemic state, HHS. Let's think this through. Diabetic ketoacidosis, DKA. This is the most likely condition. The client has type 1 diabetes, missed insulin doses, high blood sugar, ketones, fruity breath, and signs of dehydration, all classic signs of DKA. Hyperosmolar hyperglycemic state, HHS. HHS usually happens in type 2 diabetes, not type 1. HHS also tends to have much higher blood glucose levels, usually 600 milligrams per deciliter, and no significant ketosis. While the glucose is high, the ketones in fruity breath make DKA more likely. Acute pancreatitis. While abdominal pain and vomiting can point to pancreatitis, this client's diabetes-specific symptoms, high glucose ketones, point more strongly to DKA, making pancreatitis less likely. Question 4. Generate solutions. The nurse is planning care. Select the most appropriate initial intervention for this client. Administer 0.9% sodium chloride IV bolus. Administer regular insulin IV. Provide oral glucose solution. Administer sodium bicarbonate. Let's discuss each option. Administer 0.9% sodium chloride IV bolus. This is the first step in DKA treatment. The patient is dehydrated, and fluids are needed to correct this before insulin is given. Giving fluids first helps improve circulation and avoid worsening hypovolemia. Administer regular insulin IV. Insulin is essential in treating DKA, but it comes after fluid resuscitation. Giving insulin first could cause potassium shifts and worsen dehydration, so it's not the first thing you do. Provide oral glucose solution. The patient is already hyperglycemic with a glucose level of 450 milligrams per deciliter, so giving glucose would make the situation worse, not better. Administer sodium bicarbonate. Sodium bicarbonate is only used in severe acidosis, pH 6.9, and we don't have the ABG results to support this yet, so it's not the right choice. Question 5. Take action. The nurse is assessing the client's respiratory pattern. Click on the area of the body where the nurse should focus to evaluate Kussmaul respirations. Choices: chest, abdomen, neck. Think about this. Kussmaul respirations involve rapid, deep breathing as the body tries to correct metabolic acidosis. This type of breathing is best observed in the chest, as the chest moves more with deep breathing. Chest? Correct, because Kussmaul respirations involve deep breaths, which are best assessed in the chest. Abdomen. The abdomen might move slightly, but the main focus for assessing Kussmaul breathing is the chest. Neck. The neck could show accessory muscle use, but this isn't where we focus for Kussmaul breathing. Correct answer, chest. Question 6. Evaluate outcomes. The nurse administers a 1 liter 0.9% sodium chloride bolus and regular insulin IV. After 1 hour, the following findings are noted. Indicate whether each finding suggests improvement or no improvement in the client's condition. Let's look at these. BP 110/70, improvement. The blood pressure is up from 90/60 millimeter, showing better circulation after fluids. HR 100 BPM improvement. The heart rate decreased from 120 BPM, suggesting improved hydration. Glucose 300 milligrams per improvement. Dropped from 450 milligrams, showing insulin is facilitating glucose uptake. RR20 breaths min, improvement. Reduced from 28 breaths or min, indicating less need for compensatory Kussmaul breathing as acidosis begins to correct, though ABG confirmation is ideal.
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything, clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and most importantly, help you feel more ready. Good luck. You've got this.
A nurse is caring for a client who is agitated and threatening self-harm. What is the nurse's priority intervention? Choices. A. Establish a safe environment by removing harmful objects. B. Administer a sedative to calm the client immediately. C. Engage the client in a discussion about their stressors. D. Place the client in seclusion to prevent harm to others. Safety always comes first. When there's an active threat of self-harm, you don't start with meds or therapy. You secure the environment. That includes removing belts, sharp objects, cords, and anything that could be used for injury. Crisis intervention starts with risk mitigation. Once the client is safe, then therapeutic communication or medications come into play. Let's eliminate the others. B. Sedatives may help, but they require orders and aren't your first action. C. Discussing feelings is important, just not when safety is at stake. D. Seclusion is a last resort, requires strict legal and ethical criteria, and is not first line unless all other measures fail. NCLEX strategy tip. When the STEM says agitated or threatening harm, your mind should immediately go to safety first. Ask, what can I do right now to prevent injury? That's your priority answer. All right, let's dive into another important topic, safety and infection control in the hospital setting. Question, a nurse is implementing safety and infection control measures in a hospital setting. Which actions are appropriate? Select all that apply. Now, here are the options given to you on the screen. 1. Use standard precautions when handling a client's soiled linens. 2. Apply restraints to a confused client without a physician's order. 3. Dispose of used needles in a puncture-resistant sharps container. 4. Clean a blood spill with a 110 bleach solution. 5. Allow a client with MRSA to ambulate in the hallway without a mask. 6. Ensure fire extinguishers are checked monthly. Please take your time, or pause the video if you need more time to think through your answers. Okay, let's talk through each one. Option 1. Use standard precautions when handling a client's soiled linens. Yes, this is absolutely correct. Standard precautions apply to every client, regardless of diagnosis. That includes handling anything contaminated, like soiled linens, to reduce the risk of spreading infection. Option 2. Apply restraints to a confused client without a physician's order. Uh-oh, not okay. Even if a client is confused, restraints require a physician's order, and they should only be used as a last resort. This is about both safety and respecting patient rights. So this action is not appropriate. Option 3. Dispose of used needles in a puncture-resistant sharps container. Yes, this is a basic but crucial infection control measure. Used needles should always go into a proper sharps container. This protects everyone from needle stick injuries. Option 4. Clean a blood spill with a 110 bleach solution. Yep, that's spot on. A 110 bleach solution is the CDC recommended disinfectant for cleaning blood spills. It helps ensure the area is fully decontaminated. Option 5. Allow a client with MRSA to ambulate in the hallway without a mask. Not safe. Clients with MRSA require contact precautions, and depending on their infection site, ambulating in the hallway without a mask could risk spreading it to others. We've got to protect both the client and the community. Option 6. Ensure fire extinguishers are checked monthly. Yes, and this one often gets overlooked. Regular checks of fire extinguishers are part of the hospital's safety and emergency protocols. Monthly checks help ensure they're ready in case of an emergency. So the correct answers are 1, 3, 4, and 6. Remember, when it comes to safety and infection control, always think about standard protocols, legal requirements, and protecting both patients and staff. If something feels risky or out of procedure, it probably is.
Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the Next-Gen NCLEX RN Practice Question Bank, Big Book of Question Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new Next Generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions.